Some residents that seek treatment services in private hospitals say that although they have a number of reasons for choosing private hospitals, there are still some areas that can be revised. They have good services, the hygiene is generally good and the customer care is great, which is why I'm influenced to go to a private hospital instead.
Usually they take a lot of unnecessary tests, so they could earn more perhaps. That should change. They should only take the necessary one. I have experienced this, where I went to a hospital and they took many tests.
In an effort to improve service delivery, doctors in private facilities say they are committed to investing in the medical sector. Officials from the legacy clinics say they are expanding the hospital and have purchased specialized testing machines, including an MRI scanner. Dr. Ntwari Ndizeye says it will help many people in the country who usually have to wait for long at various hospitals and delay treatment.
The MRI scan gets images for every part of the body, whether to check the progress of tumors, the tumor marks. All this is now possible with this MRI machine. It will help the surgeon before they go ahead to perform any surgeries.
Dr. Muyombano Antoine, the chairman of the Rwanda Private Medical Facilities Associations, explains that they do not tolerate mistakes made because a mistake can lead to a loss of life.
If a mistake happens, we investigate and even inform the Ministry of Health, and if need be, punishments are given. As an association, we don't have the rights to give punishments. Our responsibility is to ensure that these mistakes don't stem from inadequate training, lack of resources, or negligence.
On the issue of the 1998 law governing private clinics that is outdated and the prices that have not been revised for over 5 years, Dr. Cornel Nihabose, the head of clinical and public health services at the Ministry of Health, says that the issue is currently being discussed between the ministry and the association.
The ministry have drafted that amendment and has consulted the Law Reform Commission. The Law Reform Commission has provided some guidance and provided some inputs. So at this stage we are remaining with the guidance from the higher authorities, later to be submitted to the Parliament for final amendments. We know that it is dated 5 years ago, and we must revise those tariffs. The consultation we started to know what is the rationale, how can we do it. So we agree that it can be revised, and we start some consultations. Maybe in future we can have the new tariff.
The number of people going to hospitals increased by 30% from 2015 to 2020, and to date Rwanda has 2,040 hospitals, 1,725 of them being government hospitals and 315 private hospitals.